Are you familiar with FBI Special Agents Kyle Seraphin?
I'm familiar with the name.
Is that yes?
I'm familiar with the name. Familiar with the name.
Let's bring in Kyle Seraphin. He's the FBI whistleblower who helped expose government censorship of our First Amendment rights.
Now, we only have this memo because a recently suspended FBI agent called Kyle Seraphin brought it to the public. And we're grateful that he did. Kyle, thank you so much for joining us tonight.
He's the host of something that strangely is called the Kyle Seraphin Show.
Kyle Seraphin, I can't thank you enough for speaking out. I knew you guys were out there, and I knew it was just a matter of time, but you got a lot of guts putting your face and your name to this. You're doing a service on behalf of the American people, and from the bottom of my cracked and broken heart sometimes, thank you very much.
Take a look behind the curtain with a real whistleblower and American patriot. Prepare to embrace the uncomfortable truth because this program has no time for comforting lies. Here is civil liberties enthusiast, Second Amendment defender, and recovering FBI agent Kyle Seraphin.
Well, hello, my friends, and welcome to the Kyle Seraphin Show. Today is Thursday. It is March the 28th, and we are rolling live on rumble.com/Kyle Seraphin. If you hit the like button yet, have you hit subscribe? Are you following us over on Rumble? If not, what are you doing over there? Do you hate free speech? Do you want to watch ads on YouTube? You guys, you can click on the link in the description right now, and you can go directly over to the live show where the chat is already rolling. We've got a great guest today. We're going to have a conversation. You guys know we love whistleblowers here. That's kind of what we're all about. That's kind of how it started. And we're going to bring one on today. A little different topic. I think it's going to be fun. Let's start off with a quick read, and thanks to all of our sponsors. Let's start off with the folks over at 4patriots.com. Again, it's 4patriots.com/Kyle. I need to take a breath. Man, things are getting weird. It's going to get weird this year. If you're not prepared, if you don't have some emergency foods, if you don't have some ammunition, if you don't have some safety and security stored up in your home, then you are going to be making panic decisions, and that is not the way to go. You want to make sure that you prepare so you don't have to repair. You know which one is cheaper. 4patriots.com/Kyle is the food provider that we work with. They also sell things like solar generators and other cool gadgets, gizmos, as you can see right over there on the screen. Folks, check them out. Make sure you let them know that we sent you. Again, 4patriots.com/Kyle. It's always with that KYLE at the end of it, and that is how you're going to be able to get yourself prepped up. Again, their food storage stuff will last for up to 25 years, so it doesn't have to happen bad in your area. We're not wishing it on you. I'm just saying, in the next 25 years, if you think you're not going to need some emergency food, you are the kind of person who has a lot more faith in man than I do. Again, 4patriots.com/Kyle. We appreciate it. How about our folks over at Catholic Vote? You guys, you can support Catholic Vote by going to their website, catholicvote.org, catholicvote.org, and the Loop. You can actually put just a slash and Loop, or you can sign up for the Loop and get that email every single morning the way I do, early in the morning, just before I get started prepping for the show, catholicvote.org. Today is going to be a day that you're going to want whatever news comes out of the Loop. Why? Because we're having an interview. And we're not going to be talking about news, although what we're talking about is a permanent issue. You can also follow them on social media at Catholic Vote. It's at Catholic Vote on all the major social media platforms. And let's do one more. Why not? My buddies over at Patriot Coolers. I'm just finished draining this one from all the coffee. I had actually put syrup in there today to get a little bit of a buzz to it. PatriotCoolers.com. Again, it's PatriotCoolers.com. The promo code is Kyle, K-Y-L-E. It's 4 little letters that saves you 10%. $50 or more, you're going to get free shipping, and you can tell I'm jazzed up, I'm riled up, I'm ready to go. I've emptied at least 2 Patriot Coolers so far. PatriotCoolers.com. Our buddies over there. You can follow them on social media as well, at Patriot Coolers. And they are looking, they actually will let you put a Suspendables logo, and they will laser etch it in their facility if you want to customize your own tumbler with our badge, with our other logos. You let us know. We'll put it up there. Garrett O'Boyle's been posting them over on True Social, so you guys can get that. Again, PatriotCoolers.com, our friends, and the promo code Kyle, K-Y-L-E. I think we're just going to go right over here, and we're going to bring on another Suspendable. Yeah, he's a good man. He is. This is Dr. Eithan Haim. It's like you said Akon, but not. It's Eitan. I just said I just screwed it up, didn't I?
Yeah. It's like the rapper Akon, but with C.
Who is the voice of a generation you just told me a second ago.
Like, if not that, at least every bar mitzvah for the last 10, 15 years.
That's so good. He's a general surgeon, folks. He is a whistleblower from Texas Christian. If you heard, I'm sorry, Texas Children's Hospital, which is what you saw on our thumbnail. If you heard about how the state of Texas has been pushing against trans surgeries, Dr. Haim is one of the reasons why. Buddy, why don't you tell people where you're from? I want to get a full perspective so people get a sense of where you grew up and who you are. We're going to talk about values and why you decided to do what you did.
Yeah, well, I appreciate you having me on the show. My name is Eithan Haim. I grew up in Florida. I have a brother and a sister. I have two parents. I'm very close with my family, and my dad's a doctor, and he's a pulmonologist. And I remember being young and, going out to like grocery store, going out to dinner and seeing how his patients would come up to him every once in a while. And, they would have this relationship with them that was something that was so unique that can only be had between a doctor and his patient. And you saw how much they appreciated the fact that he was their doctor. And it really meant a lot to these people. And I wanted the same thing for myself. So I went to undergraduate college in USF in Tampa, and then medical school, Florida Atlantic in Boca Raton. And then I got accepted to my surgical residency in Baylor College of Medicine in Houston, Texas. But in every way, I'm just your average Florida guy. My wife and I plan on living in a small town in Texas. We never intended for any of this to happen, but when we saw all of it happening, we knew that there was no option but to do something about it.
You started off with a reference about bar mitzvahs. Will you talk about faith in your life as you grew up and whether that was big in your house or whether it's become big as you've gotten into this?
Yeah, well, it's interesting because my parents are from Israel, and growing up, I had an Orthodox bar mitzvah at a Chabad temple, really good temple. So, it's like the very traditional Jewish bar mitzvah. But going into my teens, of course, there's that natural rebellious phase when you're growing up. So I became this radical leftist. And I used to write in the school newspaper about how, conformity and capitalism and all these things that you would see in every big newspaper now. And I was like that for years, about halfway through college. This is 2008, 2009, 2010. But then things started to change, especially when it came to Israel, because, my family is from there. I still have family living there. And then you have these conflicts that happen every couple of years. And I saw how the media would distort the reality of the situation. And it was a reality that I knew was completely false, that they were pushing out to their readers or their viewers. So it started with this small crumb that you latch onto. And before you know it, you start pulling the string. And you think, well, if this is false, then how much of everything else that I believe is false? So I just kept on pulling at that string and realized that everything I had believed in was just completely untrue. So starting around 2010, I became this avid reader. I never really read books before growing up because, I was too busy getting into trouble with my friends and my brother. But yeah, around 2010, I started just reading hundreds and hundreds of books about history, about communism, capitalism, the American Revolution, and every topic you can imagine, a lot about World War II. And it really kind of formed the foundation of this, political bedrock, the way I see the world now. But one thing that really stands out during that time is, I would read all these stories and think that none of this is ever going to happen during my lifetime. Like, things are so calm, they're so placid that these world-changing events are a thing of the past. But all that changed in 2020. And it's like that saying from, I think Hemingway, where, it happened gradually and then all of a sudden, because I knew that things were changing, but, they happened all of a sudden in 2020.
How long have you been married?
August of 2022, we got married.
And what was the connection? What is sort of the faith tradition of your wife? You guys share something in that? Was she coming out of the same faith tradition or the same sort of awareness?
Well, she actually grew up Catholic. Her father is Jewish, but her mother is Catholic. And because my dad's Jewish and my mom's Christian, but she converted to Judaism. My mom's actually German, which is an interesting story. But so she had never really grown up with religion. But then we met, we fell in love. I knew I was going to marry her after the first date. That was a fact. And after
Did she have any say in that? She had no say. You were just going to marry her.
Yeah, no, she had no say.
I love it.
Yeah. But when we started getting serious, we knew that faith was going to be a really important part of our lives. But that only became more important over the past, really since this whole situation started happening, because it rekindled that belief in a higher power in me, because so many things have happened that go beyond just chance or like opportunity, where the way things have played out, it's more than that, where it's actual, what I believe is divine providence.
It's funny how when things are really difficult, that's when we start seeing the hand of God in the world. I don't think people see it otherwise. Maybe they're not looking for it. I think it's probably always there, but it's harder to recognize, is it not?
I think it's when you start acting by the covenant that God has provided us. When you start acting in a virtuous, courageous way, that you're put in situations where you have to do things that are very, very uncomfortable and very scary. So you think that you're going to get destroyed, but then when you just act in the simplest way possible, you just speak the truth, you live by the covenant, then this story starts unfolding, and you realize that it's providence that's leading you down the right path. And it's something that I'm still kind of working out in my mind, because it's something I've recognized, I've acknowledged it's true, because I'm here sitting and talking to you, right? But the details of it, the exact way to describe it, I think is difficult, because so much of it's new.
I always tell people that it's really difficult to see God's plan as you are living it. You can only see it with a lot of perspective in the rearview mirror, and then you start going like, "Oh, okay, that's why that terrible thing happened to me, or that's why I was a bonehead when I was, and that's why these sort of personality traits were developed when they were." I can't see it when it's happening. I don't know why it goes on until later on in my life, and then you look back and you go, all of this starts making sense.
There's probably no better way to describe it than that. Because looking back over the past couple of months, past year, 2 years, you realize that, you understand why everything was there for a reason. Why I met my wife, why I was at this program, why certain things happened at certain moments. I would say that's probably the best way to describe it. You don't know what the plan is, but in retrospect, you see how the hand of God has played a role.
I had these people tell me, folks from Catholic Vote, which is one of the sponsors you just heard us read, but they said that God draws straight with crooked lines. That's a divine capability that none of us are able to do, where things arc the way they are supposed to, even though they don't make any sense. Let's talk about med school, if we can. Most people have not been to med school. Talk to me about what the education looks like, what sort of thinking is being done, if you would, and the types of your colleagues that were there, where you fit in the crowd, what sort of values they brought to it. Are people interested in money? Do they want to help people? Is it all the above? Just fire away on med school, if you would.
So both med school and residency were really important times, I think, in the history of modern American medicine, because they occurred during these transitional times. So I went to medical school from 2014 to 2018, and in medical school, the first 2 years, you focus on the basic science. So biochemistry, anatomy, physiology. You have to learn the way the body works in order to treat the body. And your third and fourth year of medical school are when you start doing clinical rotation. So you'll spend 6 weeks in general surgery. You'll spend 6 weeks in internal medicine. So during that time, you take the lessons you learned during your first 2 years about the human body, anatomy and physiology, and then you have the opportunity to apply it in the real world on patients. So that's the important thing about med school, where you have the first portion is basic sciences, it's in the textbook, and then the second half is in the real world. But the time that I was in med school was important because there were changes taking place in America where you have this woke ideology that's being incorporated into our major institutions, in academia, in medicine, in the government. And we started seeing the manifestations of that in the real world. So for me, it was in med school. So I went to, a newer, lesser known medical school at Florida Atlantic. It had opened up a couple of years before. So it wasn't that prestigious. So the great thing is that the class that I was with, the class I graduated with, everyone was down to earth. Everyone was brilliant, but they, were like these typical people, right? They were just average people who were in medical school. So they didn't have like this gunner personality that you see in all these fancy medical schools at like the Ivy League. So you had a good number of strong conservative students. So we would have these portions of our curriculum, which were like the social sciences about medical ethics, where the professors would try to push these crazy ideas about gender ideology and abortion, and we would push back with maximum aggression. And at that time, we could, we were able to have meaningful conversations in these lectures, and our opinions were partially respected.
Like partially.
And they couldn't kick us out of medical school if we had a different opinion, which is different than it is now.
Mm-hmm.
So,
when did you start medical school? Just I want to put people on a timeline again.
2014, and then I graduated 2018.
Okay, so worth people knowing that's going back 10 years ago, and even that 10 years, we think there's probably been a dramatic change in the way that it's taught.
I mean, a dramatic change would be an understatement. There's no comparison to the way medical schools are now, especially after 2020. So when you're in medical school, you start choosing which specialty you're going to go into. So around your third, fourth year, you go into a process called the match, where you it kind of works like sorority recruitment. The algorithm to match medical students into residency programs is the same that matches sorority girls into sororities. Incidentally enough, but so for me, I chose to go into general surgery. So I interview at a lot of different programs, and I was like second or third in my medical school class. I scored in like the 98th percentile for my board exam. So, I had the opportunity to go to a bunch of great programs. I interviewed at Northwestern, Cornell, UT Southwestern, Baylor, bunch of great programs.
Mm-hmm.
And I ended up at Baylor College of Medicine, which was great because it's one of the most prestigious surgery programs in the country, because you have a huge amount of history that was created at that program in Houston, Texas.
I know at least a couple of guys that were my age that ended up in their surgical program. They all ended up in plastics for whatever reason. I don't know why that was the thing they did. It probably suited their personality types too. They were a little bit more.
They were probably good-looking guys, right?
Mm-hmm.
Yeah, usually plastic surgeons, they have good haircuts. They're pretty boys,
Kind of vain.
Yeah, maybe a little bit, but plastic surgeons are good. They do good work.
Sure. The fun story, the kind of the personal little anecdote. My best buddy from high school, who always wanted to be a neurosurgeon. That was his goal in life. It's all he ever wanted to be from the time he was 8 years old. He went, and when he was a engineering student in Boston, he was interning with them. He was where was he at? I think he was at UT Southwestern. And so he was doing work there, and he was in their neurology lab. And he told me at one point in college, he called me up and he goes, "Hey man, I think we were juniors in college." And he goes, "I'm the head guy." And I go, "What's that?" And he was like, "Oh, I got this like fridge full of heads." And I was like, "What?" He's like, "Yeah, they're human heads. They're in buckets, and I give them out to people that are doing experiments." And I went, "Oh, that's a weird job." So I said, "Can we get one?" And he goes, No, you can't have a head." And I said, "Oh, okay, well, then I'm not that interested. It's not that cool." He ended up marrying one of the PAs who was in the plastics program from another guy that I knew. They were dating the same gal, or he stole the girl away and ended up marrying her. And he is now a family practitioner. He said he would have been the Rudy of surgery. He was no good at it, but he knew where his talents lie, and he ended up marrying a plastics PA, which was kind of funny. So
yeah, and it's good to know that before, like if you're you have to know what kind of personality you have, because if you choose the wrong specialty, it's a disaster. Because some people do. But, it makes me think, like, if they did give you the head, like, it's probably not a good look to have a human head in your refrigerator.
No, and I was a moron. I'm like 21 years old with bad ideas. So like you talked about getting into trouble, and sometimes you have these terrible ideas. It's good that you have friends that know better, are looking out for you and tell you they're not going to give you a human head. I have no idea why I asked him for that, to be fair. Like, I didn't have a plan. Okay. So you're in med school, you're matched up with us. You get to go to a prestigious school. You just mentioned you were at the top of your percentile, which I can already assess that your intelligence level is very, very high, which people can hear. They're hearing that right now. But that doesn't mean that you necessarily have a very high moral standing. And you actually came in there with a sort of a moral code that got challenged as you decided to go into your residency program, the surgical residency.
Yeah. And I say I had a moral code, but the first opportunity when that was challenged, I had failed because I started my surgical training in 2018. And for those who don't know, your surgical training is this very intense program. It's just like the shows, but it's crazier in real life. It's 5 years long. You spend grueling hours, 80, 100 hours every single week. So, my first day in surgical residency, I was covering nights. And this was on a service called the Castelli service, because the surgeon, his name is Joseph Castelli, and he does these massive surgeries where they replace the entire aorta. And these people are the sickest patients in the medical center in Houston. And if their blood pressure drops, then they become paralyzed because they interrupt so many of the blood vessels from the aorta that they can reduce the blood pressure to the spine. So if the blood pressure drops too low, right, they go paralyzed. And so you have these critically ill patients. And I'm like a day one intern. I'm taking care of all these patients on my own. And one of my attendings is the meanest, grouchiest, most cantankerous attending you could ever imagine.
Give people will you give people a sense of the hierarchy and the lowerarchy, let's say, also of who's in a teaching hospital? I've worked in them, but not everybody has. Yeah.
So as a resident, you're at the very bottom of the barrel. Whenever someone is looking for someone to kick or beat down, the surgical resident is the person they go to. And, that's most of the time justified, because oftentimes we make the worst decisions and make mistakes. Of course, all those are identified by people who are higher up in the food chain, and they correct those decisions. So, if people go to a teaching hospital, I don't want them to be too concerned about the quality of the care they're getting. But yeah, so you have your surgical interns, then your higher level residents, PGY 3, 4, 5. PGY stands for postgraduate year. That's what we call residents. So like a PGY 1 is an intern. A PGY 5 is a chief resident. And then you have the attendings. But even within the attendings, you have this hierarchy where you have the newer attendings, which still will get beat down and get embarrassed in front of everyone. And I saw that my first, second day of residency, where
brutal.
You would have these attending surgeons being made to be like to look like children in front of the whole team, all of the patients in the middle of the surgical ward, and then at the very top is like the top dog, and the entire atmosphere is determined by the top dog. So if that person is a malignant type of personality, then every minute of every single day you're going to be walking on eggshells. And in some services, that's kind of how it was.
Can we just discuss the irony of the fact that probably the most alpha masculine career that we know of that's not physical, so it's not military, it's not law enforcement, but when it comes to just pure meanness and capabilities driven and meritocracy is what goes on in most of these residency programs and especially in teaching hospitals, they have also adopted all this weird woke ideology, which is like the softest, most fake, compassionate garbage. How do these two sort of meritocracy and aggressive type A personalities vibe with that bizarre ideology?
Yeah, and just to underscore that point too, I mean, I would say that just in the way that other physical professions like they're physical, where they have to interact with the real world. I mean, with surgery, that's exactly what it is, because you're physically operating on these people. And these people are big, they're bleeding. You have to combine, sheer strength with very delicate movements around major structures that if you screw something up, they're going to start hosing blood and that person's going to die. And the type of personality that goes into it, people have this false idea that surgeons are these narcissistic, kind of godlike people, but I would say in reality, it's the exact opposite.
Sorry about that. We had a little a little sneak in there that wanted to interrupt us.
Yeah, no worries. But every surgeon I've met is humble, is measured, is prudent. The reason is because when you deal with surgical pathology on a daily basis, you are constantly humbled to the nature of the diseases you're taking care of. So even if a surgeon, has a big personality, when it comes down to the most important moments, they're always measured, because no matter who you are, if you're the most expert surgeon in the world, if you're leading your field, you always get humbled by things you never could have expected. So, yeah, it's and then you take these people, right? These surgeons who they live and die. Like, we live and die by this code, where you have to take people to the operating room for a reason. You have to live by these medical ethics, because if you don't, you're really going to hurt people. And then in 2020, you saw this massive shift take place, where even the strongest surgeons, the people who control the hospital, who have so much power, had conceded to, these really what amounts to like college students, right? The people in the department that no one respected, the craziest ideas. But all of them, no matter all the disease they would take on a daily basis, all the courage to take, when it came to that, they had all floundered. And I saw that the whole way through, because in 2018, 2019, I worked with these titans of surgery, but then I saw how they all caved to pressure at the flip of a dime.
I'd never really considered the concept. In the military, we talk about guys that are like high level operators. You've probably heard this term before, which is funny because you're doing actual operations, and a very different type of that. Physical operations of being military versus being in a hospital and operating on a person. But that same mentality of constantly being humble, having the volume turned down in your life because you make life and death decisions. Like you said, strength and gross motor skills with fine-tuned things. Guys that are kicking down doors, but then they're making this tiny little trigger press that has to do something. There's a lot of commonalities that makes a perfect amount of sense to me. And I also think that it's kind of interesting to think about how all those people that were all over the military, we have got guys that are special forces generals that also cave to this woke ideologies, like professional killers that have gone overseas and done bad things to bad people. And then you've got these surgeons that are in the hospitals that are making life and death decisions and literally holding their organs in their hearts, and tiny little cuts are going to make the difference between whether they survive or not. And those people couldn't just say, hey, boys have a penis, girls have a vagina.
Yeah.
Like kindergarten cop level stuff.
The people who had the most power and the ability to make a difference had decided to stay silent. And it goes to show the strength of the ideology in academic medical sector. Because no matter who you are, you could be the top surgeon in your field, but if you transgress this neoliberal leftist ideology, they will take you out no matter who you are. And with surgeons, we put so much time and effort into our careers that for so many people, there's this fear that we give it all up and for making a stand. And, so many of us think that, well, we have this mortgage, we have this career we have to take care of, we have to take care of our family. So we have to maintain our career. But I think it's a false calculation, because they don't realize that if they don't confront these issues, if they don't fight against it, what they're really doing is just passing that fight along to their children. So they think they're taking care of their kids, but they're really not, because the world they're delivering their children into is a much more dangerous world than the one they grew up in. So they think that by staying silent, they're protecting their children themselves, but what they're really doing is just foregoing the fight that needs to be had. They're just taking care of themselves.
I've been having this thoughts throughout the week, and this is a perfect segue into it for this day. The question is this: men, specifically, men who are supposed to lead, men who are supposed to do the right thing by their children, by their wives, by their society. Like, what are they saving it for? And you just said it very articulately. They're delivering their kids into a world that's worse because they think that they're defending something. It's the same thoughts I had when I was looking at the FBI. I was like, am I going to retire with a pension? And I said, well, I kept a roof over our house, over our heads. We were able to eat. You live in tyranny now. The communists took over our country, and I didn't do anything, but at least you got to live comfortably while you were a teenager. This is the interesting thing for me, especially in your story, and I'd love you to articulate how you came to this calculus. Because you're looking at people at the top of the industry, the people that have all the power, as you said, in your field and your influence. And they're terrified to upset the status quo. As the status quo drifts further and further to the crazy left, they're not willing to step up and go, hey, guys, what are you doing? Like, we're surgeons. We know about biology. We know about physical structure, and we're not going to go do this. We're not going to go hack body parts. It took you, you're in your surgical residency, right? You're at the terminal end of your surgical residency, doing a rotation at Texas Children's, and you went, well, and I'm guessing you have student loan debt. Do you have debt?
Yeah, well, luckily that's all handled at this point.
But you had debt when you were going in there, maybe.
Luckily not.
Oh,
yeah.
Okay. So this is yet another reason why you and I have some similarities, because you had some financial capabilities to go into this, and you made a bold decision that just said, hey, I may have just put 10 years of my life on the line for nothing, but this is wrong. Let's talk about, first of all, what you saw, if you'll give folks that, and then how you started about whistleblowing is it's such a personal, every single situation is its own. So let's dig into it.
Yeah. So for me, it really starts a little bit earlier in 2020 with COVID, because, maybe for like a week, I kind of had bought into it, but then I quickly realized that what they were perpetuating were lies and propaganda, that masking, social distancing, contact tracing were not measures that you use to control a pandemic like COVID. These are not things that make rational sense. They have no therapeutic rationale behind it. And, it's one thing to describe it in theoretical terms, but in the hospital every day, you see what happens on the ground. So for me, I was taking care of hundreds and hundreds of people. So I saw countless people who suffered and died alone in the hospital, without their loved ones, without ever having the chance to say goodbye. And that was one of the most painful things to ever see. And the whole time you're going through it, you think that someone's going to stand up and say something about it. Someone has to realize this is all crazy. But as I progressed more and more, it was just getting crazier and crazier, and no one was saying anything.
Was anyone talking like in break rooms or on the side, like, hey, this is terrible. Like, we just had an old lady die and we told her family they couldn't come in?
The way it would work is we would have to sub-communicate. I had to sub-communicate with other residents. So I would have to say something kind of benign, to another resident who I thought might think in a similar way.
So you're like sounding them out to kind of see if they agree with you.
Kind of like in East Germany.
Yeah.
Right. Where you say one thing to see if they're like on the same wavelength. And then maybe a couple of weeks go by, then you say something else. And then you say something else. And before you know it, you're organizing, just you and this other person or two other people in like dark corners to talk about how crazy things are. But the worst was what I saw happening to children, because when you had the emergence of the lockdowns, we saw the number of cases of child abuse, really horrific cases of child abuse, just skyrocket. So I became very familiar with the sound a mother makes when you tell her that her kid is dead, because these kids usually the signs of abuse are picked up in society, at school, right, in public. But when there's no opportunity for that, the abuse just continues. So I was seeing this epidemic of abuse unfolding, and it was horrifying. And no one was doing anything about it. And then when I thought that it couldn't get worse, right, the ideology had just proliferated in the entire medical establishment. It had silenced every voice that I thought had a responsibility to do something about it. And when I thought it couldn't get worse, you see this transgender ideology start blossoming.
Can you flesh out? I don't want to derail you, but I want to know what you mean specifically. What kind of abuse are we talking about? Are they physical, sexual, psychological, whatever?
Everything. There was one girl, because kids aren't in school, they're kept at home. Mm-hmm. And when kids are kept at home in these, situations where there's a lot of turmoil within the family, a lot of times there was one kid who would be chosen as like the rag doll. That was a common pattern that we would see. There was one kid that would get beaten up on. So there was this one girl who came in, and she looked like she was maybe 7 years old, but she was really 12. And the reason is because she was so malnourished. And her blood counts were so low that we thought she had leukemia. But it was because she was malnourished. And the reason she came in is because she was missing her thumb. Her thumb was hanging off just by a little piece of skin. It was started to get infected. And the reason is because her parents were putting her fingers into a fan and chopping off all of her fingers. And most of them had already been amputated, but her thumb was partially amputated, and it was just hanging on by a piece of skin. And, this is the types of things we would see during the lockdowns. And these were all measures for a virus that had essentially zero risk to this population. So, and then you go into the room a couple of days later, and the parents are in the room, right? And CPS doesn't do anything, right? So you see this breakdown of our institutions at every level. But then also I see it in myself because, I pushed back in every way possible, but we had no opportunities, we had no power as residents. There were a couple times where, my contract, it was threatened that it would be terminated because you would have trauma patients come in getting shot, and the first thing they would do is put a mask on them. And which is crazy because, someone gets shot, you won't put a mask on, right? Because they have to breathe. I started to realize very slowly that no one else is going to do this, that it's my responsibility because there's no one else coming. No one else is going to stand up for these people. No one else is going to make a statement and say what's true because everyone's too scared. So once I made the realization that no one else is going to do it, I had to do it myself. So that's when Texas Children came along.
Can we talk about the conversations you had at home? I know that moment when you're going, who's going to fix this? And I think, and this is why I reference Isaiah 6:8 all the time about, God says, who shall I send? And Isaiah says, here I am, which is just it's an availability statement. It says, I'm available for tasking. What am I being asked to do? And when you have that realization that like, here I am, I'm being asked, it's not a good feeling. It's actually horrifying. And you got to talk to your spouse about it, or you got to talk to your loved ones and kind of work that out.
It was terrifying. So just to give a little background for that answer, so during our residency, the 5 years that we're training, the main institution we train at is Baylor College of Medicine. But the hospitals that we rotate at, there's a number of them. So we would rotate at Ben Taub General Hospital, which was the county hospital, which is where we would see all the trauma. We would rotate at the VA, and then at St. Luke's, where we did big cancer surgeries and a lot of general surgery. But one of the hospitals we spent the most time at was Texas Children's Hospital, which is the biggest children's hospital in the world, one of the most prestigious. And it was around mid-2022 that I had been notified by one of my co-residents that they had just inserted a puberty blocking device into, a pre-adolescent child. This person told me about how this child had all these psychiatric issues that were being unaddressed. And over the next couple of weeks, more and more people started telling me about how they were doing these procedures.
Why are they telling you?
Because it was people who other people who knew it was crazy, and they wanted someone to confide in. But even with that, they still did the procedure, which is, they were kind of put into that situation. But it was when I didn't know Texas Children's had this transgender program. I had no idea, because you imagine this thing happening in California or Seattle, but definitely not in Texas. So it was, I started looking into it, and I looked online. Of course, the first thing you're going to do is try to Google it, see if you can find any information about the program. And there was no indication that the program existed online. And I'm like, that's weird, because every program at Texas Children's, they treat the rarest diseases. All of them have a webpage. And it makes sense, because you have to schedule appointments, you have to find out who the doctors are. And there was no indication that the transgender program existed. I started doing a little bit more digging, and I found a statement from March of 2022 where the hospital had unequivocally said that they were shutting down the transgender program because of the legal risk. And I want to highlight one important point. They had said they were shutting down the program because of the legal risk. So they acknowledged that there was a risk of criminal conduct, right? And the reason they released that statement was because a few weeks before that, the Texas Attorney General, Ken Paxton, had issued a opinion saying that these interventions could be investigated as child abuse.
Mm-hmm.
So the hospital, it kind of makes sense. They would release this statement saying, you know what, we're shutting down the program. We're not doing it anymore, because they want to cover themselves. And they inherently know that the people of Texas wouldn't support this kind of thing. Parents wouldn't bring their children to a hospital if they knew that this kind of thing was happening. So,
And would it be fair to say, too, in your experience being around doctors and people working in the medical industry, and certainly was my case working as a paramedic, like fear of legal action is massive. Like nobody wants to deal with the litigious society. And I know doctors are constantly worrying about whether or not they can afford to pay their insurance premiums, about malpractice. So if you're on the wrong side of the law, like that's way worse than being on the wrong side of the insurance company.
Yeah, exactly. And that's the thing, because for a doctor to have any legal issues, especially criminal legal issues,
Mm-hmm.
is a major problem. And for a hospital to be in that situation is like a institutional defining event that can destroy an institution, right? And especially because Texas Children's is an amazing hospital. I mean, it's one of the best hospitals I've ever worked at. They do great work, but has been taken over by this ideology in their leadership. So a light bulb kind of went off, right? But it was slow. I thought, is the largest children's hospital in the world lying to the public about the existence of their transgender program? Did they tell the public that they were shutting down the program when in actuality, behind closed doors, they had continued it and only expanded the scope of its practice? Like, I didn't think it was possible for the hospital to make such an insane decision. Because when they released that statement in March 2022, that had to have been cleared by every level of the hospital, the chief legal counsel, the CEO. So then, and also, I'm going to answer your question, the one you had about like that fear of the responsibility. So a few months go by, and more people start telling me that these procedures are being done, and the horror stories just start piling up, where you have young kids who are saying that they want to have more surgery in the future, where they don't want to have kids. They firmly believe they're going to live as transgender for the rest of their lives. But these are 11, 12-year-old kids. who are being put on puberty blockers, their entire life is going to be changed. But then in January of 2023, so 7 months after that statement, there was a Zoom conference with members of the transgender clinic and like a group of 150 medical students. And they would talk about how they were running this active clinic, how they would blackmail the parents with this lie that either you're going to have a living son or a dead daughter. But there was even one social worker who said, in order to avoid scrutiny from governing medical bodies, she wouldn't document the consults to the clinic. She would call them. So, like in medicine, that's insane. Like you're admitting how you're concealing what you're doing from governing medical authorities. And it's just unbelievable that she would say that.
It's also, and this was the social worker you're talking about?
Yeah.
And I have to imagine that the social workers have the same sort of requirements that medical practitioners do, from the lowest level tech all the way up to whoever the head of surgery is that if it's not written down, then we can't say that it happened. We haven't documented it. It's not going to be written down. Then we don't know that it happened. It's like, oh, I took vitals in this time. Really? Where are they? Because then you didn't, because I don't have them.
Yeah, so it's one of our absolute primary responsibilities. The importance of it cannot be overstated. I mean, that is the way in which we communicate, the way in which we document everything, support our diagnoses, everything. And for her to be like, oh, well, you know what? In order to avoid scrutiny, we just call them instead of write them.
And isn't that an admission of wrongdoing as well? Like from your listening position?
It would be, of my opinion, that constitutes potential criminal misconduct.
It's the same thing as someone saying, "Hey, we're conspiring to do this thing, so make sure we use these apps or whatever it is, so we can hide what we're saying, so we can keep it away from prying eyes, because we're going to do something illegal."
Yeah, and this is just behind closed doors, but this is a publicly available Zoom conference they're having with 150 medical students. We had heard about it, so we had recorded the Zoom conference, right? But then also the directors of the program which supposedly does not exist, were given the opportunity to speak at the hospital's most prestigious lecture series only 2 weeks before that. And I watched the lecture and it's like, oh my God, like here they are talking about like their algorithmic approach to treating all these pre-adolescent kids who are confused and troubled with puberty blockers and hormones. And they were advising pediatricians to ask about gender identity behind the backs of their parents. And if you're just an average person from Houston and you bring your kid into the hospital, you're working under the assumption that this doesn't happen. This program doesn't exist. So it was at that point that I realized the largest children's hospital in the world was lying to the public about a program that was manipulating, mutilating, and sterilizing confused, troubled, pre-adolescent and adolescent children. And at that point, I knew I had a responsibility to do something.
How did you feel about having to take that burden on?
Yeah, it was terrifying because it was those conversations you have with your wife, to go back to your original question, where you think, am I really going to do what I think I should do? Because I saw how my moral code was challenged during COVID, where I knew no one was going to stand up for what was right. If you don't do it yourself, you always expect other people to do it, but you have a responsibility to your future children, right? And I just found out my wife's pregnant, like, a few weeks ago. We just found out it's a girl, and it's amazing. But, there comes a time where you have to be willing to sacrifice everything, because I wouldn't be able to look at myself in the mirror if I didn't speak out. Because when you boil this down to the most basic sense, what this is child abuse. And as a doctor, I have a professional responsibility to report child abuse. But I also have a moral responsibility as an individual to make sure that this does not persist, that these kids are not, medically altered in a way that's going to take away their opportunity to have children in the future. Where they're unable to have normal sexual, meaningful relationships. And think about how much you love your children, how much you love your wife. And there's nothing more than that, right? And we're taking that away from these kids when they're at least able to understand the consequences. So, yeah, it's terrifying, but then once you understand what's at risk, that these kids are being harmed, it becomes very easy at some point. It became really easy to know what was the right thing to do.
My buddy Steve Friend says it's not easy, but it's simple. And
Yeah.
you may adopt that terminology as well. We've all kind of walked down that line where you say that decision is hard. And the other thing that I think is interesting, because I don't know anybody that's been, something happened and they were like, no, and they threw the flag down and they said, this is where I stop. Usually it's multiple pushes. I don't think God expects us to be able to get it right away. And so you get challenged and you realize like, oh, that's not how I want to respond to this. I always say prepare or repair. I talk about that in my advertisements, but I also talk about that in our lives. If you haven't prepared to experience this thing, and most people have never been challenged the way that you're talking about, the way that I was, my buddies are, you haven't really set yourself up to be able to know, hey, you're going to throw the fastball and I'm going to knock it out of the park. And you got a second shot at it, like we often do. We're often challenged twice. And by the way, massive congratulations on a new baby coming to the world. I see if you're having a girl, then you're in the same boat that I am. I got 3 of them. So I think men who have a bunch of daughters probably have some sins to pay for in their life. They have to go back and do a good job as girl dad. So that's really exciting. Yeah. I look forward to trading some stories about that when you guys get closer.
Yeah.
What was your first action now that you've kind of determined what that path looks like? Where do you go?
So it was January 2023. And I was going into my last couple of months of surgical residency. So, I had a job lined up, everything, I was getting ready to graduate 6 months from that point. But so I started reaching out to journalists, and I didn't know anyone. I was not connected to any conservative circle. I was just a random surgical resident in Houston, Texas. So of course, the only place to start was just sending emails to journalists.
Mm-hmm.
And I would just send dozens and dozens over months. And, all the organizations that you think would be interested in a story like this either didn't believe it or thought I was lying to them, because the story itself is kind of absurd, right? It's almost hard to believe that the biggest children's hospital in the world is lying about this program, and it's going at every level of the hospital. So I was just persistent. At the last minute, when I was going to give up, this was May, after 5 months of being rejected, either because people thought it was too controversial or they didn't believe me. I finally got a hold of Christopher Rufo's team in mid-May of 2023, and he was interested in the story. He understood the importance of it. And for anyone who's not familiar, Christopher Rufo is the conservative journalist who's done a lot of work on DEI, and he released this story with Claudine Gay that eventually got her fired. He's a brilliant journalist, and he knew the importance of it. But he also knew that there was something coming up in the Texas Senate that I had no idea about. So it was, kind of like what you were talking about, like the divine providence that you don't foresee, but it happens when you fulfill the covenant, right? When you act in the way that religious scripture dictates. So the week later, maybe a week and a half after I got in touch with them, the Texas Senate was voting on a bill, SB 14, which would ban all of these interventions in children. So hormones, puberty blockers for children under 18 with gender dysphoria. And so he knew that there was a lot on the line. So if we released this story in time, we would be able to have an effect on the Texas Senate, and that people who may not vote in favor of it would vote in favor. So we go through the verification process, make sure that everything's buttoned up, that I am who I say I am, and I'm providing reasonable, credible information. We get the story out on May 16th, 2023, all over the big headlines. And in the story, I just served as the anonymous whistleblower. So no one knows who I am. I'm just completely anonymous. And the next day, Texas had voted on SB 14. And the story did exactly what we hoped it would. The law got passed with bipartisan support. And there were multiple Democrats who voted in favor of it because the story came out the day before. Because many people didn't even know this was happening in their district. And the reason I know that is because I met the guy who wrote the law, and he told me it was amazing. His name is Tom Oliverson. He's a Texas senator. He's an amazing guy. And the story was handed out paper copies to every member of the Texas Senate the day of the vote. So so it had a really big impact. Yeah.
You're anonymous at that time. Let's talk about moving into the light. It's a weird experience as well. It's another scary sort of option. What made you decide to be public about it?
Yeah. So, a few other things that happened after the initial story came out. Another whistleblower came out from Texas Children's. It was someone who had worked with these doctors who described the horrors of seeing how these kids were putting on blockers after 20, 30-minute conversations, how they didn't understand the risks. And then, so that was huge too. That was like 3 days after. Then the Texas Attorney General announced an investigation and then into the hospital. And then the CEO for the second time in 14 months says that he is shutting down the program in accordance with the law. So fast forward a month, June of 2023. It's the day of my graduation from surgical residency. So one of the most important days of my life, right? You sacrifice all this time, all this effort, and you're graduating. So it's a Friday, early afternoon. My family's in town, and we're getting ready for the ceremony later that night. And all of a sudden, I get an aggressive knock on the door, and kind of odd, right? Didn't really expect a knock on the door like that day, that time. So I shuffle over, I open the door. Standing outside are two federal agents with Health and Human Services. They show me their badges and tell me that they're investigating the case regarding medical records. So, in that moment, everything kind of shuts down. You just freeze. You don't know what to do. And my mind went blank, but there was a part of me that knew exactly what was happening. We had challenged the dominant political ideology a month before, right? If doctors know they can blow the whistle anonymously, imagine how many other people would do the same thing and how many other people would be inspired to speak out, because that's what happened. And there was someone else within a few days who spoke out, Christopher Rufo, in another story about the same thing. So we knew they were there to make an example out of me. But of course, you're not thinking about any of that in that moment. So I just invite them in, right? Because the doorway was very awkward. And we sit down and they want to do an interview. So they set up a tripod and I'm like, oh shit, maybe not the best thing. But my wife comes out. She was getting ready as well. And an important part, she was undergoing a federal background check because she had been hired as a assistant U.S. attorney in the Northern District of Texas. And but we had not told them at this time. It plays an important role in the story later. But she sits down, we look at each other, and then we go back to our bedroom, and we both know that talking to them was not the right idea, was not the right thing to do, right? Because we knew what they were there for. They were not there to pursue justice. They were there to silence me as a whistleblower and to punish me for speaking out.
Let's just hold on that for one moment, because it's so critical that we convey this point to people and how blessed and fortunate you are to have had a spouse who knows that, because you're married to an attorney. And the other thing is that your examination of conscience had already been done and you already knew it was at risk. Many people do not. They get themselves in a lot of trouble because they're just going to straighten this out. There's plenty of comedians that talk about that moment. You sit down and I'm just going to straighten it out with the cops. It's you're going to do 20 to life. I don't even know what you did, but they're going to find it. These guys were not there to administer justice because you had done nothing wrong.
Yeah. Yeah. And that's the thing is there's this part of you that thinks oh, you know what? I'll just talk to him. We'll kind of iron everything out, explain my side of the story. But people don't realize that when you're interacting with a corrupted Department of Justice, people believe that their innocence is their best defense, that ultimately they will become vindicated. But they don't realize that when it's corrupted, it is because they're innocent, because they were virtuous, that they're being targeted in the first place. So I kind of knew that going into it. I knew that that was a possibility. So in that moment, right, it was those instincts that kicked in. So, we tell the agents that, we would not speak with them without an attorney present. And they're like, okay, no problem. But before they leave, they hand me a target letter. And this is just a piece of paper that had informed me that I was a potential target of a criminal investigation. And it was signed by a assistant U.S. attorney with the United States Department of Justice. This assistant U.S. attorney was in the Southern District of Texas, which is the same position as my wife, who was in the Northern District of Texas. And then a few minutes after the door opens, right, the door closes, agents are gone. We had that decision to make. Do we fight or do we stay silent, right? Do we try to comply? And we knew that, like, they were there because they wanted to intimidate. They wanted to instill fear. They wanted me to comply with this phony, bogus investigation. We knew they wanted to silence me as a whistleblower and what their intentions were. But, as they have come to find out, they had knocked on the wrong door, because that day we decided to fight, and we would sacrifice everything we have, everything, my freedom, our finances, our employment, everything, to do the right thing.
They miscalculate this a lot. They are used to people doing exactly what happened during that COVID lockdown, where everybody whispered in the corner, that East German sort of mentality that many of us talked about, or that we all kind of saw. You can go further back. It's the story of the ordinary men during the Holocaust who just, hey man, I'm not the one putting the canister in. I just put people on a train. I don't know what happens after that. The fact that they never come home is not my business. That ordinary men mentality where I'm just following orders. And those agents, they're complicit in it, whether they know that they were doing something wrong or not. They may not. They may have thought they were doing the right thing because you are a medical records violator, they thought. And so they're out there doing their job, and no one knows, but we know how it works when you look at the bigger scope. So you guys have this moment. You've decided, wrong door. We're going to put it all on the line. What's your next step?
Yeah. So the next step that day was, we get in touch with Rufo, who puts us in contact with our attorney. Her name is Marcella Burke, and she's a character. I mean, she's a really, really big personality. So she is this attorney who is really well connected in the conservative movement, because she has a very strong Catholic foundation. And she's also a fighter. And she had left Big Law, a position as a partner in Big Law, making 7 figures, because she didn't want to put pronouns in her bio. So she had led this exodus of other conservative attorneys to start her own law firm. And then a couple of minutes after we talked to Rufo, we're on the phone with this attorney, Marcella Burke, and we realized that, she's like this strict Catholic, rosary in one hand, middle finger in the other, bulldog of an attorney. So we're like, she's the right person. But then, of course, afterwards, so we were going to hire her as our representation. So, so that day we opened up 2 bottles of champagne, sat on our patio, played this old Vietnam War music, and then planned our war strategy. But, and then we went to my graduation and celebrated with my family and then everyone I had trained with. But to go back to your question about why I decided to go public, the reason is because of our interactions with the Department of Justice over the next couple of months. Because, you're not really sure what to do. Like how aggressive do I want to be, in this whole thing, because you understand there's so much at stake and I can lose everything. So, brave words are always possible in the moment, but the next morning and the morning after that becomes much more difficult. But then, after interacting with the Department of Justice, we knew what the right decision was. And my attorneys had even blown the whistle themselves after their communications with the assistant U.S. attorney. This is detailed in a letter that my attorneys had sent to Congress. So anyone can look at it and see what the misconduct was. And so that's what I'm going to discuss is that letter. And the reason is because if I talk about my communications with my attorney, that would violate attorney-client privilege. But because this letter exists, it's public, I can address that.
Mm-hmm.
And what I had experienced was my attorneys had reached out to the prosecutor, and the letter demonstrates that, the first conversation with this attorney in the Southern District of Texas, she didn't even know the details of the case before sending the agent to my apartment, before initiating the investigation. Right.
And did it start with DOJ or did it start with those Health and Human Services agents? In other words, agents can initiate an investigation on their own. The United States Attorney's Office can also request an investigation, which doesn't have to get picked up. Do you know where it started?
I would say most likely Health and Human Services. It would be my opinion that that's where it started.
Okay.
And they just used her as the source to through the Department of Justice to initiate the investigation.
Mm-hmm.
But she had no idea what anything was about, right? She didn't know anything about the case, about the details, about what was even being alleged. She didn't know what statutes were being investigated. And it's like investigating a murder case without checking to see if the person's still alive, right? It's crazy. So even though she didn't know any details about the case, they did enough research, either her or the agent, to find out that my wife was undergoing a background check for her job as an assistant U.S. attorney. Because during one of those conversations, the prosecutor had mentioned that, my wife, Andrea, she's not going to have any problems with the background check unless she starts to become difficult.
Oh, like the mob deals with people.
Yeah.
Yeah, nice business, nice little background check you got going on there. I'd hate to have it be a problem by you getting too involved in what's going on with your husband's business.
Yeah. So, and what she was referring to was my wife encouraging me to use a constitutional right. And it didn't appear to me that using my constitutional right would be, interfering with an investigation. So a couple months go by, and then the details of this letter, explain and illuminate the misconduct and the abuse from this prosecutor. And she had mentioned that I had no right to blow the whistle as a doctor. That if I had a problem with what was going on, I should have just stood on the sidewalk with a sign, right? That's not my job as a surgeon to report child abuse, right? That I have no responsibility. She had mentioned that she would pursue this investigation. She would take it to court, to a jury, right? To a jury trial, even if she was confident that they were going to lose. And the implication being is just to make my name public, to make us, to deplete all of our financial resources, and that other people can bring lawsuits against me. So the list goes on. There's about 15 points where it outlines this profound abuse from the prosecutor's office. And it was after a couple of months that you had this accumulation of experiences that you realize, like, we're going to get destroyed if we keep this behind closed doors, because that's the territory that they operate on, right? That's where they succeed, because if anyone hears about what's happening, the corruption becomes self-evident. So that's why in January of 2024, I decided to take the story public with Christopher Rufo.
I want to put your Give, Send, Go up real quick. Folks that this resonates with, there are many of you that are parents that know what is at stake if the institutions that we have to bring our children to are not outed for doing corrupt and evil practices. You can check out the Give, Send, Go. We're going to have that in the show notes, but I want you guys to see what it looks like so you know you're at the right page. It's a legal defense fund for surgeon whistleblower. That's what you're going to see there. And that money, which you guys have raised $218,000, I'm sure will get eaten up very easily in legal fees because you're defending yourself, but you're also defending the process of bringing the story against a corrupt DOJ. Go figure. Me and my buddies know a little something about this corruption. How crazy that she decided to come in and threaten your wife's career, and then suggest, we just saw this not too long ago. They won't press charges against Joe Biden, even though he had classified documents, because he's an elderly old man, and they wouldn't be able to put a jury involved. The jury wouldn't be able to convict him. And they said, even if we couldn't convict you, we're going to bring it, because we want to just make sure the process is the punishment. That's what we're about in the DOJ.
And it would also and I understood that this was an important precedent set, because if they can silence me as a whistleblower, then any other doctor or nurse or healthcare professional who sees this kind of thing happening in their hospital and decides to blow the whistle, they know that they would be targeted and destroyed by the federal government if I didn't do anything about it. So I knew that there was a lot on the line, that if they are allowed to get away with this, there's no other opportunity for other doctors or nurses to blow the whistle. So this is like the last chance to maintain accountability within the healthcare system. And especially over the last couple of years, we know that it's more important now than ever. And but also about that legal fund, I would say it's a little bit different, because we knew that, like in my case, like if I just put my name out there and just talk about this abuse, right? Talk about the misconduct at this prosecutor's office, just talking about it is meaningless. What we have to do is achieve consequences and accountability. So it's less of a legal defense fund, I would say equally a legal offense fund, because that's what we're doing, right? We are pursuing every route possible in order to hold her and all of these individuals accountable, including Health and Human Services. And the first step in that was that the letter that we had sent to Congress, to Jim Jordan's committee. I'm sure you're very familiar with that too. In order to initiate the process of investigation, and we're hoping that it'll come too. But then also, working on writing amicus briefs for other challenges to states that pass laws banning these interventions. So myself and my attorneys have written a couple of briefs supporting these bans, and we've kind of done it underground during a couple of months when I was still anonymous. But we knew that it was important as much to do that as anything else, because if we don't go fully on the offense, then I'm just going to be destroyed. There's no, right? That's what would happen.
You're correct. My buddy George Hill says this is a fight for our lives in many different fields, whether you're fighting the institution of HHS or DOJ or a lot of these other institutions. And if you are not constantly putting your opponent back on the mat, then they're going to get their footing and they're going to level you, because they got a lot bigger hammer than you do. And so I applaud that you just have that fight instinct. I love that you guys knew from the minute that it was go time, that it was time to get on. What I want to focus on, and as a kind of a conclusion, at least for this particular, and you're welcome to come back anytime and chat with me because I enjoy it a lot. Two things. Number one, let's do professionally where you're at right now and the reception that your eventual employer, because you had a contract to go work. And then let's talk a little personal. Let's talk gun stuff at the end here. We'll wrap up with that sort of thought, because I think people will get a kick out of it. You are just a regular, like you've said, a regular guy a number of times, but you and I vibe on a bunch of levels. So let's talk about your employer. You had a contract. You had some agents knock on your door. What's your employer say about you coming to work for them after all this stuff?
I won't get too much into it because, they can speak for themselves, but I'll just say that I work with really, really amazing people. People who care so much about the doctor-patient relationship and what we would consider true medical ethics. So I'm a general surgeon. I have a busy practice. I was operating a lot this week. Last week I was in clinic 2 hours before, I was on this podcast. So I'm a busy general surgeon in a really small town outside of Dallas. And I would say the biggest way it's impacted my work is, I'll get dozens of letters in the mail on my office every day for people who say thank you for standing up. And, I feel so humbled every single day to have people do that because I feel like I am unworthy of it because, I'm just a regular person, but it means so much, especially for the people who've donated on the Give, Send, Go, because it's actually going towards something to hold people accountable. But yeah, that's primary way it's been impacted, and yeah, I'm still operating, still busy.
Yeah. So broadly speaking, would it be fair to say that your employer is comfortable with the stance that you took?
Yes, I would say that. Yes.
Your job is not in danger for your actions.
Yeah. Especially when you get out of the academic medical center, you get to small town America, you realize that doctors and even administrations of hospitals in small towns are horrified, absolutely horrified by what is happening. Absolutely horrified. And they understand that, and I'm not talking about my hospital, but broadly, that there has to be a response, that people have to do something, and that if we don't, we're going to lose our profession, right? If people like me don't stand up, and then there's going to be no profession to hand my children one day.
I just have this word amen kind of echoing in my head right now. So I'll say that. This is a stressful thing to do. It's a stressful time to be alive for everybody in a lot of ways because of what's going on, but very stressful to be a whistleblower, to know that your professional career is in jeopardy and that the DOJ is bringing its ugly head to bear on your life. What are you doing to blow off steam? How do you breathe a little easy? Are you a bourbon drinker? Give me some personal things that get you detoxed as you guys look towards adding more stress and a baby that doesn't let you sleep.
Yeah, yeah, no, that's true. That's true. I would say it's two primary things. Three. I love reading, and so I try to go through a couple books every month. I play a lot of music. I've played guitar for years. And just privately, but then also guns. Truly.
I don't know how that came up in our first conversation, but it came up out of nowhere.
Yeah, I love building them. I love shooting them. I love looking at them. It's like because once you kind of start going down that rabbit hole, it's just such an amazing thing, because you realize that you have these tools which are not meant for harm, but are meant to protect the people you love the most. And you see how, with the Second Amendment, that this is not just some passive amendment to our, in our country, right? This is not something that we just say, but something we have to live. So, I bought my first gun in June of 2020, when they were burning cars outside of my wife's apartment in Houston during the BLM riot. And I knew that I had to take on the responsibility as a husband and as a protector in order to take care of the people I love the most. And that's going to be my wife and my future daughter. So ever since then, it's building rifles, shooting rifles. I just got, a thermal optic. So looking forward to going hunting soon at night. Yeah.
Gonna knock out some coyotes or something, or some pigs?
Yeah. I got an ATN Thor 5, and it's beautiful.
Are you on did you say east or west of Dallas?
East of Dallas.
Okay. I got some friends that are west of Fort Worth. I may talk you. They got some pigs that might need some killing if you got the tools for it. So we'll discuss that. We'll discuss that at a later date. I'll give you some kind of moments to clear your head. By the way, if you've never been to Texas, people, and you don't know about the hog problem we have here, there are feral hogs that run around and they destroy things, and they need to be killed. They need to be eradicated, and nobody feels bad about putting them down. So that's what we're talking about here. It's so interesting that these things align. I don't know how we landed on guns when we first started talking, but the instinct towards freedom and defense. Do you have any formal training that you've gone through? Have you gone through any courses?
Yeah, a couple. Yeah, I think training is an important thing, because not only is it about like pulling the trigger and seeing a bullet go downrange and hit a target, but it's about knowing how to handle it, how to keep it safe, how to reload it, how to, but also having ear pro on, your equipment, your plate carrier, but then making sure that your rifle is set up in a way to be comfortable and be usable when the moment's necessary. Because if you have a rifle that's not 0 to 100 yards and you can't judge where that 0 is if you're shooting at 10 or 25 yards, then that becomes pointless. You have to be able to not only do it yourself, but communicate to other people. right? Like 100 yards, right? It's the reticle is going to be on the target, right? If it's a little bit closer, then a little bit above, right? A couple inches above. But I think there's something brilliant about shooting firearms and then, surgery, because it's all about precision and accuracy, right? Where when you shoot a rifle, you have so many things that go into pulling the trigger, the setup of the rifle, how you position it, how you breathe, how you think. And then when you pull the trigger, you hope that round will go downstream and then hit the target where you want. And when you're accurate, that bullet will go exactly where you hope it will. And in life and in surgery, that's what we do as well, right? When you implement a treatment, when you operate on someone, you hope that you are identifying a problem and that every move you make with your hands is going to go towards solving and treating that pathology. So accuracy and precision is kind of embedded into our core as a surgeon. And when I picked up shooting and firearms, you realize that it's the exact same way. And just like we have to protect patients, right? You have to protect your family and your community with your firearm. So.
Very well said. I'm going to give you a chance to plug the social that you'd like people to go. I pulled it up on the screen here, so I'll give you a chance to tell people where to follow you at and what sort of messages of hope they can send you, or if they want to send you, hate mail or whatever. There's not from this podcast. They won't happen. I'll throw it on the screen.
Not much hate mail. I've only gotten like 2 emails, which is surprising. But
yeah, you got to step up that game. Those are rookie numbers. I like getting the angry ones.
Yeah. I think those are kind of entertaining. But sure. So if anyone wants to donate, they can go to givesendgo.com/Texas_whistleblower. And the important thing for people to know is that this is not only a legal defense fund, but a offense fund, because our goal is to hold these people accountable as much as possible. But the way we mean that is in the most severe way possible, right? Through legal processes. And then on Twitter, that's the only thing I have. I never had social media before that, which is, I guess a good thing, but that's Eithan Haim on Twitter. So.
And that is spelled out EITHAN, and then the second is HAIM. Did I get it right, Doc?
Yes, sir.
That'll be in the show description, folks, if you want to follow, and you should keep track of this. If this is a passion of yours, which protecting children should be all of our passion in Western civilization. Another warrior in there. Will you come if we do a suspendable shoot of a bunch of my guys, the whistleblower team, coming out and doing some shooting? Will you come shoot with us? Oh,
absolutely. Yeah.
Okay. We're going to do some tactics. We're going to try to shoot some pigs. We're going to try to figure it out. I don't know when it's going to happen, but when it does, we'll make it happen.
We'll do the Tannerite and the hog trick, right? Yeah.
Will you tell that you got to tell the story before we wrap up then?
Yeah. So, called the Tannerite and the hog trick, right? So, you have someone who's a new shooter and you take them out hog hunting and you kill a hog beforehand, but you fill it with Tannerite and you put it out maybe 50 yards, something that a new shooter can hit easily. And you set it up to where it looks like it's alive. So you tell the person to shoot this hog. It's like their opportunity. And they shoot it, and the thing's going to explode. So that's the Tannerite and the hog trick, where the person's probably going to freak out, shooting the hog for the first time and not realizing that's packed full of explosives.
I'm going to give you another trick for new shooters. It's very fun, especially if you're in Texas. The key is you need a revolver in either 357 or 44 mag. Okay. And either of those weapons will shoot either 38 special or 44 special, right? They'll shoot a lighter load. And so the key is that you take new shooters and then you take your wife, probably not when she's pregnant, but you take your wife and you have her show this friend who's never shot before how to shoot the revolver with the 44 special or the 38 special round. So you're giving your wife the light load, crack it back, fire it, fire. Okay. Then you load it with a full power mag load and you give it to your guy friend who thinks he's tough and let him watch it just jump out of his hands. And then, they won't know the difference because they're new shooters. They've never seen this before. So then you load it back up with specials. You give it back to your wife. You're like, look, she's going to show you how to do it. You're not controlling the recoil very well. And she handles it, no problem. Then you load it with the full power and it's jumping out of his hands. You just let him wonder, man, Really got to get better at this. I did this with my wife from New York when she was very new at shooting, and she made some Brooklyn guys look really bad. It was my favorite little trick.
Yeah, that's one thing I cannot wait to do. So,
there we go.
That's gonna be good.
Doc, thanks for joining me today. Appreciate it so much, folks. You can donate to the Give, Send, Go, and you can follow them on social media. And I hope you'll come back. We'll talk again, especially if there's any updates. When these evil people start, they don't quit usually. So we'll be there.
All right. Thank you so much. I appreciate you having me on.
All right, brother. It's been my pleasure. So there we go, folks. What you think? Let's wrap this thing up in a good way. Let's still go ahead and throw up the merch store. You guys can go to the merch store at the-suspendables.com. It's the-suspendables.com. Use the promo code Kyle, saves you 10% if you're trying to pick up something from my buddy Garrett O'Boyle. Another suspendable. Man, Doc Haim, what a stud, huh? Look, we got the pins. They just came in. If you guys didn't get one yet, you can order 3 of these for $30 and you can hand them out to somebody who should remember to do the right thing. But I think the doc is going to get one of these. We're going to put one of these in the mail out there to him. I got a couple of them that I can hand out. You got to earn these. And unless you guys think otherwise, you tell me in the chat. You guys go ahead and put it out there. Give me a 1 in the chat if you think that the doc should be sporting one of these on his scrubs when he rolls around that hospital. The-suspendables.com is where you can find your Suspendables merch. You can get any of the cool shirts. The Kyle Seraphin Show shirt, which is abbreviated TKSS. Yes, that's how me and the boys talk about it behind the scenes. We always send messages. What's going on TKSS this week? Pretty funny stuff. Go ahead and go to the-suspendables.com. Put the sweatshop to work for you. Let's do a 5-star review as well. We might as well. Here it is. And this one is coming from T. Cambogi. Gambogi. What do you think? T. Cambogi says, Friendly Friday. Kyle, I just listened to Friendly Fridays. You're getting a whole lot better at this. I love the animation with the information. I don't know what you're talking about specifically, but I'm trying to get better every day. So I appreciate you acknowledging the work getting put in there. Folks, this has been the Kyle Seraphin Show. I hope you enjoyed it. We enjoyed bringing it to you. I will see you again tomorrow for that Friendly Friday. Look forward to seeing Steve Friend in the morning. And God bless you. Be good to each other. Be ready to do the right thing. You're going to be asked. I don't know when it's coming, but we're all going to get there. See you soon.
Thanks for listening to the Kyle Seraphin Show, streamed live weekdays on rumble.com/Kyle Seraphin. Follow Kyle on Twitter, Truth Social, and Instagram at Kyle Seraphin.